So birth planning came about with presenting women with all of the options that could be before birth, during birth, and afterwards, including care for their infant. Going through all of those options and seeing what's acceptable according to their plan with their partner. So we implement birth planning somewhere in the third trimester, giving enough time for us to review it in the office. And this will let them choose their pain management, what kind of atmosphere they would like, who they would like to be present, who are their support people, what interventions they would like, what kind of communication style. And also after the infant is born, what will that look like? What will happen? We like to do healthy mother, healthy baby so that we leave the infant in the room with the mother, not taking them to nurseries, doing skin to skin, delayed cord clamping, all of those things which help with bonding. So those things are very important. We know that just overall improves outcomes for our babies and decreases NICU admissions and ultimately hospital stays. But we want to empower them to ask the right questions. So when you present the birth plan, they know exactly where they should start and how do they begin this conversation about what it is they expect. First-time mothers often do not know what it is that they should be asking about. So these birth plans help them in that regard. And then we want to make sure that we set up proper care for our infants once they're born. So pediatric care, we get the conversation started about that. Do you have a provider? Can we give you any recommendations as to where you can secure a provider, for yourself? Those are very important things that we want to make sure that our mothers are aware of.
So I think men are very important. It's very important for them to be present throughout that process, prenatally and during the actual labor process, because it helps all of us. And I always joke with my moms that come in, because they'll come in with their husbands or their significant others, and I'll ask them questions, and then the patient might say, oh, let's just blah, 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 blah. And then the husband will say, well, actually last week she had this, that, and the other. And then last month before that. So they actually will tell me the truth a lot of the times. So they actually are very good advocates. And I think that they should just continue to do that. Like, be an advocate in the office with that patient. Because if I'm coming in and I see she's got a support person there, again, biased. I'm like, oh, okay, she's got support. Somebody's got her back, right? So that's important for me to know. Number two, sometimes the woman going through the situation, she's not purposely downplaying things. She just may forget, or she's like, oh yeah, this happens all the time, so I don't even worry about it. But he will say, Doc, she is short of breath when she gets from the bed and goes to the bathroom, and it's getting worse. Or yeah, I have noticed that her legs are swollen, her hands are swelling. And so they will give me information that's pertinent to how I'm gonna take care of this patient, and they don't even realize it. So I think they're being advocate is by telling the physician what they think that doctor should know, that the woman is not saying, making sure they're present in that room with them while they're laboring, trying to talk them through the process, what's going on, how you feeling. I can't tell you the number of guys that have come out of the room and said, I think she needs her epidural because the contractions are getting stronger and she's not doing well, right? But we need that because we're busy taking care of other patients. We need someone to come out and say, yeah, it's time for the pain management because she's not handling it, right? Or even coming out and say, you know what? She doesn't look good. Can somebody come and talk to her? So when I talked about earlier having an advocate, that's what the husband or the boyfriend or whatever, that's what they need to do. And a guy who is really in his woman's corner, he's going to do that naturally, right? So don't feel like you have to sit back and not speak out and not talk about what you see as important. We need that because all of these are helping us with the pieces of the puzzle to help the woman.